What are 3 good food sources of copper? A. Sesame seeds, cashews, green leafy vegetables. B. Grapefruit, pear, bean sprouts. C. Beef, eggs, apples. D. Tomatoes, bananas, rice. The answer is A. Sesame seeds, cashews, green leafy vegetables. Sesame seeds, cashews, and green leafy vegetables have among the highest levels of copper per serving. Other foods high in copper include crimini mushrooms, organ meats, shellfish, and beans. All of the other foods listed are low copper foods, often recommended for patients with disorders of copper metabolism, such as Wilson's disease. By what age should an infant be able to pull itself up to standing? A. 6 months. B. 12 months. C. 9 months. D. 18 months. The answer is C. 9 months. An infant should have the ability to pull itself up to standing by the age of 9 months. If standing is not seen after 12 months, the child should be evaluated for any type of physical developmental disabilities or delays. At what age can an infant begin eating solid foods? A. 4 months. B. 3 months. C. 9 months. D. 6 months. The answer is D. 6 months. Solid foods should not be introduced into an infant's diet before 6 months of age. Earlier introduction may trigger specific food allergies, as well as reducing breast milk production in a breastfeeding mother. An audible click when the examiner slips the femoral head forward is considered positive for what sign? A. Scarf sign. B. Babinski sign. C. Ortolani sign. D. Brudzinski sign. The answer is C. Ortolani sign. An audible click when the examiner slips the femoral head forward is considered a positive Ortolani sign. This finding suggests congenital hip dysplasia. Babinski sign is the presence of the Babinski reflex, which is normal in infants. Scarf sign is used to assess developmental age and muscle tone in neonates. Brudzinski sign is not related to the musculoskeletal system but is part of a physical examination in cases of suspected meningitis. At what age does the posterior fontanelle close? A. 4 weeks. B. 12 weeks. C. 16 weeks. D. 8 weeks. The answer is D. 8 weeks. The posterior fontanelle, which is the cartilaginous gap at the junction of the lambdoid suture and the sagittal suture, closes at 8 weeks of age. The answer is D. 8 weeks.